Hi, my name is Riffat Bukhari, and today I want to talk about a topic many of us are familiar with procrastination. But I want to look it through a different lens. Instead of seeing it as a simple failure of time management, we will explore it as a deeply human response, a form of emotional escaping, and will discuss an empathetic path towards self actualization. So, what is procrastination? On the surface, we think of it as just putting things off. But psychologically, it is much deeper. It is a strategy that brain uses to avoid difficult feeling like anxiety or self-doubts. While some form of delay can be strategic, like active procrastination to work better under pressure, our focus today is the chronic passive procrastination that causes significant distress and hold us back. To understand why we procrastinate, we have to look at the emotional root. It is often a subconscious attempt to manage overwhelming feeling. It could be triggered by the perfectionism, the fear that our work will not be flawless, or a fear of failure, where delaying provides a built-in excuse. It also happens when a task feels meaningless, or when we feel disconnected from future self, who will have to deal with the consequences later on. Neurosciences give us a clear picture of this internal conflict. It is a tug of war between two parts of our brain. The limbic system, our emotional core, seeks immediate gratification and wants to avoid pain right now. Whereas the prefrontal cortex, our rational planner, knows we need to complete the task for our long term benefit. Procrastination is simply the moment the impulsive limbic system overrides the rational prefrontal cortex. While procrastination offers temporary relief, the long term consequences can be threatening. It can lead to the professional stagnation and the persistent feeling of not living up to our own potential. Mentally, it creates a powerful cycle of stress, guilt, and shame, which is strongly linked to anxiety and depression. The consistent stress also impacts our physical health and can erode trust in our personal relationship. Ultimately, it becomes a barrier to living a full and healthy, authentic life. So, how do we heal this pattern? The journey begins with the creating emotional safety. In person-centered therapy, the relationship itself is the most powerful tool. When a client experiences unconditional positive regard, true acceptance without judgment, it directly heals the shame that drive procrastination. Through empathy and the therapist's own authenticity, the client learns that it is safe to be imperfect, and that could start to build a more compassionate relationship with themselves. With that foundation of safety, we can build inner resources. Mindfulness teaches us to sit with the uncomfortable feeling instead of immediately running from them, which build our emotional tolerance. Self-compassion, developed by Dr. Christine Neff, is the antidote to the harsh inner critic. It is also about treating ourselves with the same kindness we would offer a friend, fundamentally changing our internal dialogue from one of shame to one of support. Once we have self-compassion, practical strategy become tools for support, not punishment. We can gently challenge perfectionism by giving ourselves permission to be imperfect. Breaking large tasks into the tiny steps make them feel manageable. Simple trick like the 2-minute rule lower the barrier to starting while framing tasks as an act of self-care for our future self help bridge the gap between our present and future interactions. Thank you very much for hearing me.